So documentation, audit and feedback. This is a very crisp and short form of answer. In anesthesia practice, these are all crucial for ensuring patients' safety, quality of care, and promoting accountability. These are the reasons why this is given more importance now. Ensuring patient safety, improve the quality of care to the patient, and also accountability. Nobody can say, I don't know why this complication happened, or how this complication happened. You cannot say that. Just make somebody accountable for that. And documentation provides a record of care of the patient in all stages, pre, intra, and post-op. And audits systematically review practices against established standards, and feedback mechanisms help individuals and teams to learn and improve. These are the three reasons for that. Documentation provides record of care. Audits review practices against a standardized guideline or protocol. Feedback helps in improving the standard and learning. And first, documentation is done manually by Harvey Cushing in those days to introduce this to clinical practice. And it serves as a concise document in the preoperative, intraoperative, and immediate post-op. So it is a perioperative management of all the events is called documentation. And they are the vital for communication and continuity of care and legal compliance. These are the three main reasons. One is, especially when you do a long case for say 12 hours, 15 hours, the same team may not be continuing. One team may start and then hand over it to the second team and go off after 8 hours of duty. When the shift gets over, you have to hand over to the other team. At the time, this recording will help the new team which is coming in to take over the patient, find out what has been the behavior of the patient throughout that period of 6 to 8 hours when the previous team was managing, and whether any untoward incident happened and that has been rectified. Is there a possibility of similar complication happening again? All that can be found out by looking at the chart or record. So it provides vital for communication, continuation of care, and it is a very important legal document. If any mishap happens or mortality happens, nowadays the courts always ask for the records of the hospital and go through that and try to find out whether there is any medical negligence. So from that point of view, if you have not maintained any document properly, that itself is a big offense. So you have to give very great credibility to that, to make it very sincere and fill it up correctly. And documents could include patient demographics, physical examination findings, including airway, cardiovascular assessment, medication review, allergy information, especially for food as well as any other system medication, and whether the patient has had informed consent, what is the anesthesia plan, and any emergency plans for alternative management. Everything should be documented. And good documentation aids in identifying potential risks, and we can optimize the patient health based on that. For example, an uncontrolled diabetic coming for a BK amputation who is in DKA, okay, he has a very high risk for surgery. So you have to properly optimize the patient and then choose the anesthesia technique that will have the least effect on the cardiovascular and metabolic changes, and that will ensure safe anesthesia administration. And it also helps in medical legal, as I said, and facilitate effective communication among the healthcare system. Now coming to audit, this is involves systematically reviewing the care against predetermined standards or protocol, and audit is mainly for improving the patient outcome so that you can avoid mistakes that have happened in future, which you find out in the audit, you can avoid them in future. And helps in identifying areas where practice deviates from established standards or guidelines. And audit cycle includes setting standards for measuring performance as well as re-auditing after you have changed the plan or the protocol. you can again re-audit them to see whether it has provided any improvement or not. And again, take a view on that and correct it further. And the audit can focus on medication safety, infection control, patient satisfaction, and adherence to clinical guidelines. So these are the points against which you have to do the audit. And it can also improve patient safety, reduce adverse events, enhance the quality of anesthesia care. And coming to the last part of the question, feedback. Feedback is the response to audits. So what feedback you give is always based on the audit or criticism that has been done by going through the records. And it is essential for promoting learning and improvement in anesthesia practice. It can provide it can be provided in various forms. How the feedback can be submitted is, it can be as a written report, individual or group discussions, and comparisons with peer performance. And effective feedback mechanisms can lead to changes in behavior, improved compliance with guidelines, and better patient outcomes. Okay? So feedback should be constructive, specific on a particular technique or the management, or it can be focused on areas that can be still improved. Okay? For example, the turnover time. For example, you put a list and it gets prolonged and goes on beyond the working hours, or some cases get cancelled. So all that can be avoided by proper feedback and rearranging your schedule or posting the cases in the correct way. All that can be done. So that is how the feedback helps. Okay, so these are the few points that you can remember and then enlarge your answer on that. But even if you write whatever I have shown, that is more than enough for such questions. And you can add the features of aims that you say this is the modern way of doing this feedback audit and documentation audit and feedback is all incorporated in the aims, which is used nowadays as one of the important tools for providing better care and patient safety. Okay, that is the thing about